I'm Dr. John McDougall, and I'm a board-certified internist, and I take care of people, but I'm also a grandfather. I think that's the best way to think about me. That's my whole goal in life is the future and children. And sometimes you ask, well, why does he speak the way he does? And it's because there's no other choice. As I mentioned to you before, I don't want my grandkids to look back and say, Grandpa, why didn't you try harder? So if you find the next 30 minutes disturbing, offensive, or whatever, just remember where I'm coming from. I'm not invincible. If I get hit by a bus, I die, etc. So I had an accident about 1.5 years ago. And you may ask why. I don't know why. But for whatever reason, I fell in the middle of the night. And I was injured very badly. Here's my picture. This is me just a couple months ago. Not perfect, is it? I'm kind of lopsided. I've been lopsided for 50 years since my stroke. I'm kind of old because I am. But that's what I look like. And if you notice, I have a tattoo on my chest. You will never know unless you go to Kauai this year whether or not that's a real tattoo. And then I will take my shirt off. But otherwise, I have a tattoo on my chest. Do not, Cath. I will sue. My injuries, well, I had something like a flu. So it was after the advanced study weekend in February 2015. I went home and I had the flu. The result was I lost my hearing. But just temporarily, fortunately. Any of you who were patients in the next program, you know I had to sit with headphones on. Rob set it up for me, a mic system, because I couldn't hear you. And Dr. Forrester saved my life, who's here in terms of that program. I lost my balance. I'd not been myself for maybe, certainly 3 months. I sat in that chair to recover. And it's taken me over 6 months, maybe a year, but I'm back. You have any doubt? I'm back. When it happened, Mary, of course, was very upset, and she wanted to call an ambulance and take me to the hospital. I insisted she not. Please help me back to bed. And it was disturbing for her. You can just imagine to see her best friend laying on the floor, totally incapacitated. But she did. She listened to me. And why didn't I want to go to the hospital? Because I've been there. I've worked there. And I don't know what would happen to me. If I'd have gone to the hospital, they'd have looked at me and they said, well, why'd he fall? Could have been a cardiac arrhythmia. We should probably look to make sure. And he has a history of atherosclerosis. Good grief, the guy had a stroke at 18. And he's all lopsided, walks with a limp. So we got to cath him, see what his arteries look like before we do any further treatment on him. And if they had talked to me, they would have heard that back in maybe 20 years ago, my brother Bill had an opportunity to get me a free heart scan. And just out of curiosity, I did it. Mary was clean when she had hers done, but I showed calcification. And I have no doubt that calcification is still there, but we'll go on and talk about that. And I had a past history of a cholesterol of 338 when I was 24 years old. Without medication, I've had it checked a dozen times. And my cholesterol is what you see here, 131 to 151, 137 to 151. But as I arrived in the ER, the cardiologist would have come in, and if I would have had no consciousness, no ability to defend myself, believe me, I'd have been in the cath lab. So how do I protect myself next time if it happens that I lose control, consciousness, and I'm taken to the ER? Do not cath. I will sue. Okay, so why do I reveal myself to you? Why would I take my clothes off and reveal myself to you? It's to grab your attention and to help you. That's the reason I've done this. Case in point, good friend. I do not want to violate any privacy, but this was a fully functional, working man who I know extremely well, who received a diagnosis of colon cancer. And before they would treat his colon cancer, they insisted he had an examination of his heart and prophylactic revascularization. That means prophylactic, you know what that means, like a preventative. Revascularization, like put stents in. They insisted he have that done at 90 years old. Oh, we'll get on to the story. So he had it done. They consulted me, but not about this. I recommended conservative treatment. But this happened. They took him to the Cath lab. He had 2 stents placed. He had 2 heart attacks and 4 cardiac arrests. He survived, but he will never be the same. He needed to be treated for colon cancer. In 2004, it was proven that prophylactic revascularization does not save lives, even in people with terrible atherosclerosis all over the body. So the doctors who operate on him and I knew that this approach of fixing the arteries before you say you have your hip pinned or your colon cancer, your prostate operated on, this has been proven beyond a doubt to not work. A study recently published, it was actually 2016, May of this year, which inspired me to write the newsletter, which you can read. It is in, what did I put, my July 2016 newsletter? Or May? Probably May. Well, this study came out and looked at people who had chronic coronary artery disease who came to the hospital and what happened to them. And half of them, these are people, some had symptoms, some didn't, but it was chronic disease. Half of them were told that they must have their arteries fixed, revascularization, before they were allowed to continue to have their non-cardiac surgery. This is criminal. So we're talking about chronic coronary artery disease. How common is chronic coronary artery disease? We're talking about blockages in your heart arteries, old blockages. How common is that? Well, you can look at your cholesterol level and you can see how common it is. This is on somebody less than 40 years of age. How often do you find closure when you look at their arteries? Depending on the cholesterol, it could be, if your cholesterol is less than 200, it'd be 20%. If your cholesterol was what mine was, when I was less than 40 years of age, the chances of finding chronic coronary artery disease are 91%. So if you look, you will find. Do not, Cath, I will sue. Based on your age. And this is looking at moderate to severe coronary artery disease. Based on your age. I'm near 70. So what's the chance of them finding chronic disease? If Mary would have taken me to the hospital, they'd have looked at my arteries, what's the chance? 91%. So plan on it. If you go to the hospital, you will be examined and you will be treated. That's their job. So when they look at the arteries, what do they see? This is an angiogram. You see the arrows pointing. What are they pointed at? Well, this is what they operate on. This is what they say. Ma'am, do you know what we call this? What do we call this? Widowmaker. This is the blockage, and we need to rush your husband to the operating room. What these are old scars. Most of you have them. I gave you the statistics. Old scars. If you look, you will find. I told you that when I had a heart scan done maybe 20 years ago, that my calcium score was high. Well, think about what I used to eat. I've told you. I lived on bacon and eggs and hot dogs. And as was mentioned, not just a slice of pizza, but the whole darn pizza. And so what I have in my arteries is I have old scars filled with calcium. The result of chronic inflammation is the body lays down scar tissue and calcium, like chronic tendonitis or bursitis. They take a picture, they see calcium. Or tuberculosis, the classic sign of TB, is a chest x-ray showing calcification. Or if you go for a mammogram, what they show is they show calcification in your milk ducts. due to chronic inflammation caused by the Western diet. This calcification and these scars, they are there, they stay forever. It's like when you fell off your bicycle and you hurt your head. You got a big gash. You were 6 years old and you still have a scar. But is that scar troublesome or worrisome? Heck no. It's as strong as the rest of the tissue. You fall down, you're likely to bleed from any other source. These are old scars and they're not dangerous unless they're found. And when they're found and how they're found is they take a catheter. By the way, this was started in 1979. First one's done. First 50 were reported in 1979. What they do is they take a catheter and they usually stick it through the groin, sometimes the arm, and they go up into your heart and they put dye into your heart arteries. And what they find is they find blockages, and then the next thing they do is they stick another catheter up there and they break up the obstruction. And then what they do, they break up the obstruction with this catheter you see here, the chronic disease. And then what they do is these days they commonly prop them open with like a Chinese finger puzzle thing with a mesh called a stent. It could be a bare metal stent, but because those fail quite often. Well, let me just back up and give you the rates. When you have the catheter put into your arteries, and you have this scar expanded, the risk of reclosure is half the patients within 5 months have total reclosure of that artery. If you put in a bare metal stent, which causes the body to proliferate smooth muscle cells, the rate of complete closure due to smooth muscle cell proliferation is 40% at the end of the year, complete closure. So what they do is they put in cancer chemotherapy drugs called drug-eluting stents. That's what they are now, which keep the cells from proliferating so the bare metal stays there. Problem is the body doesn't like bare metal, so it often clots and kills you from these stents. Studies done. Angioplasty fails is absolutely consistent. You can look at the Old study. It's looked at 2,200 people with stable occlusions that were done, were examined 2 to 28 days after their heart attack. Now, I do have to make a very important qualification, which Dr. Osner made and will probably be made by Dr. Ornish in the next minute, is that heart surgery can save lives, and we're talking about angioplasty in particular, if you get to the hospital within 90 minutes. More than 6 hours is too late. But if you get there within 90 minutes, the blood clot, which I'm going to demonstrate to you in a minute, can be dissolved by infusing blood-thinning medication. That might not be the right word. Dr. Mandrola would call it something else. But by putting in drugs into that fresh blood clot, if you do it within 90 minutes, you can save heart muscle tissue and maybe lives. So I give them that. But after 6 hours, it's too late. The muscle is dead. The clot is organized. No benefit. As says the Oat study. Courage study said the same thing. 2,300 people, evidence of serious heart disease. They looked at those who were treated medically versus those who were treated surgically. Actually, those treated surgically did worse. You want to look at a review? Here's a review of 12 randomized trials, intervention trials, no surgery versus surgery. You say optimal medical therapy, what's that? A few statins, a couple of aspirin. Go to the hospital, you have a heart attack, they serve you the very food that brought you there in the first place. They just did a recent study. It was a recent study. They did a study of the long-term benefits, not just a few months or a few days, but long-term benefits, and these are benefits of 15 years. Published in 2015 in what they consider the ideal of journals, the New England Journal of Medicine. Marcy Angel, who was the editor of the New England Journal of Medicine, quit after 13 years, quit being the editor because it was so corrupted by the drug companies. I'm trying to get Marcy here, Angel. Well, anyway. So 15 years later, no benefit for surgery. They did a recent study where they looked at people who had totally occluded arteries. And they opened them up. So no benefit. No benefit in survival. You will find no study to the contrary. This is absolutely clear and consistent. Dr. Steve Letterman is a non-interventional, he asked me to emphasize this, is a non-interventional cardiologist. You can ask him. You can ask Dr. Mandrola. You can ask Dr. Osner. You can ask Dr. Ornish, who's going to be here in a couple of minutes. You ask him if there's any inconsistency with what I just told you. Well, let me explain to you how you have a heart attack and die. This chronic disease, these old scars that you see on an angiogram or you see with a heart scan with the calcium in them, these old scars are stable. They're history. They're what you get operated on for. But these are old scars, and you have them. I showed you, you have them. That's not what kills. You need to know what kills and how we need to approach it. And this has been addressed by Dr. Osner, Dr. Mandrola. It will be addressed again by Dr. Ornish. What happens is an element of new disease, of new damage. When you eat injurious food, it damages the inside of the arteries, and as a result of this damage, what happens is they develop sores, like pimples inside your arteries. And what happens is these pimples, they pop. And when they pop, what happens is a blood clot forms. Suddenly, boom, just like that. Blood clot forms and you have a heart attack or you have a stroke. Yeah, it just happens that suddenly. It's from new pustules that are present. That's what kills. Start out with a clean artery. This is a clean coronary artery or any artery. You have 44,000 miles of arteries, by the way, which this affects. So you start out with a clean artery, and you damage it with products of cigarette smoke combustion, oxidized cholesterol, food poisons, animal foods. And by the way, recent trials, they used to try and treat coronary artery disease back when I was a young doctor by substituting saturated fat with corn oil and safflower oil. You know, it was to switch to polyunsaturated fats. Recent studies show consistently that feeding these omega-6 fats result in more damage, more death to people with or without coronary artery disease than does feeding them lard or beef, etc. So you damage the arteries, and what happens, the result of damage, injury, like if you get a sliver of wood in your skin, the result is the body responds with inflammation, white blood cells come in, you get a pustule, and these pustules, they grow. They're healed too. The body comes in after, there's thousands of these going on in your body. I mean, not you guys, but the average American. These pustules, what happens, the body tries to heal them by bringing in fibroblasts, which lay down fiber, which produces old scars. That's how you get the old scars. But some of them break. They break, the products of injury are released into the blood. The result is a sudden blood clot, and you die. This is called acute coronary thrombosis, which is synonymous with a heart attack, because that's essentially how all of them occur. I wrote about this in a book I published more than 20 years ago. I guess it was 20 years ago. About how these little pustules, they break open, they release products of injury, and then a blood clot forms. This is not new news. Everybody knows it.
In healthy coronary arteries, the blood flows without obstruction. In diseased coronary arteries, a fatty substance called plaque forms in the artery walls, and as the disease advances, may bulge out into the path of the onrushing blood. blocking the oxygen and nutrients the heart desperately needs, and from time to time, causing symptoms like chest pains and shortness of breath. But heart attacks result more often from plaque that does not protrude into the artery itself, but remains hidden in the artery wall.
One of the scariest things about coronary artery disease is that it can remain silent for so long. You can have plaque buildup in the coronary that isn't causing you any problem, doesn't cause you any symptoms, doesn't even cause a positive stress test, but suddenly ruptures. It ruptures, it causes a blood clot to form, the rest of the coronary artery, the rest of the pipe suddenly gets blocked, and a heart attack occurs. And that's really the most common cause of heart attack. This is
what kills people in the prime of their life, is what he continued to say. Now, as I say, we've known about this forever. An Annals of Internal Medicine letter was published in 1992, and its title, Money, Fun, and Angioplasty. And as you read this, back then in 1992, there were like 300,000 angioplasties done in 92. I told you there are 800,000 done now. But what this author said, he said, there's never been a confluence of situations in all of medical history like there has been to promote the angioplasty business. And in the last sentence, he says that it's very lucrative, patients are mostly self-referred, and it's fun. You know, you're in the operating theater, you've got your team of nurses and interventional people standing around, and you're pushing these catheters through, and everybody applauds. Oh man, you got that turn, we got it. Oh, it's so fun. It is fun. You think I joke. Do not, Cath, I will sue. So what's the motivation? Why do we treat old scars? Because we can. Yeah, because we can. 80% of a typical hospital's income comes from heart disease. 80%. You got some figures on the cost of open heart surgery. It can be more than $300,000. And that's where they cut your chest, open your chest cavity, put you on the heart-lung machine, give you a 100% chance of brain damage from the heart-lung machine. Does not save lives. You pass over $3,000, your insurance company does for that. Could you possibly turn that down? Not if you're a normal human being. Or if you have angioplasty, it could be as much as $150,000. Could be as little as $50,000, or you could go to India, and probably a lot cheaper. By the way, I went to India. They're worse than we are here in terms of physicians and their behavior. I bet if I went to China, it's the same thing. This is the old world as has been discussed for you. This is the old world 35 years ago or longer. We live in a new world where everybody's sick. China, Japan, Thailand, Africa. You've heard this over and over again this week. It's happened for the last 35 years. Now there's a documentary. Dr. Esselstyn's watched it. You can get it on Amazon, I believe. You should. Have you seen it? It's a documentary called Widowmaker. It's well worth your time and trouble. I think it was paid for by the cardiac calcium scan business. That's how I think they paid for it. But they talk to the experts on both sides about whether or not heart surgery works. And it's absolutely crystal clear what they say is that this is a criminal business. And what they do leave out, unfortunately, in that Widowmaker presentation is they talk nothing about what is real and important, which is that you can prevent and reverse this disease with diet. They totally leave that subject out. But take your time, whatever it costs. You can find it on Amazon or Netflix. It's easy to find. Watch The Widowmaker. Show it to your cardiologist. If you're in the hospital business, oh, don't do it. You'll lose your job. Oh, yeah. It's all about the money. Okay, cardiologists just doing business, just business, plain and simple business. In 2007, the American Heart Association, the American College of Cardiology, and we've had the president here, Kim Williams. to speak. Both organizations in 2007 said to doctors, stop doing this. And they studied what the response is. There are 2 studies. And I quote them in my May 2016 newsletter. You look at both of them, but both of them say the same thing. So I'm just going to show you one. Archives of Internal Medicine. Look at the title of the article. It's the impact of national clinical guideline recommendations. Those from the Heart Association, the American College of Cardiology. What is the impact for revascularization, in other words, the performance of heart surgery, on patients with persistently occluded infarct-related arteries on the clinical practice of medicine? In other words, these organizations, professionals came out and told doctors to stop doing this because the studies are absolutely crystal clear that this does not save lives. So how did doctors respond? No change. They did nothing. In the article, it says the results of the study are of cause for concern on 2 levels. First, they imply that many stable patients with recent MI and persistent infarct artery occlusion continue to undergo a costly and ineffective procedure. And they said, second, we're spending all this money to do these studies, and it results in no behavioral change. Huge studies. There are over 30 studies published that all say the same thing. This does not work for chronic disease. Money drives the business. In an editorial, they say it's the money. It's personal financial gain in a fee-for-service business. The more you do, the more money they make. And the question in this editorial is about honesty. Ladies and gentlemen, you need to save yourselves. The business has no interest in your future. They are in business. The sooner you get over this naivete that these are people that are next to God and they will take care of you, the sooner you will save yourself from unnecessary treatments and suffering. Do not, Cath. I will sue. The reversal of this disease. My first understanding of showing the reversal was by Walter Kempner at Duke University, which was published before 1950. He looked at people with chronic coronary artery disease. They looked at their EKGs. Those of you who can read EKGs, you see on your left-hand side ST depression, which is a clear indication of blockage. And so what Walter Kempner did is he put them on the rice diet. You think things are tough here. He fed you rice and fruit juice and table sugar. It's one of my heroes, but we don't need to go into that. So he showed clearly that you can reverse coronary artery disease back when I was a young child. We've talked a little bit about Caldwell Esselstyn. He published some observational studies showing you can reverse this disease. Very impressive. He's been here to talk and speak and so on. I've seen a few patients myself. This guy is worked for the Attorney General office in California. He is an attorney. His job was to sue physicians his entire career. So he got coronary artery disease, and because he knows physicians, spent his life suing them for the state of California. When he got coronary artery disease, he said, "Oh, no way." He had high blood pressure, diabetes, high cholesterol, et cetera. Robert Cross, he's been here, many of you know him. He said, "No way." His general doctor sent him to a cardiologist. Cardiologist did a perfusion scan, showed significant blockage. He said, "No way." Got on the internet, as many of you have. You didn't pay a dime. You got on the internet and you saw my opinion about this. And he changed his diet. And all his medications went away. His chest pain went away. His cholesterol dropped 140 points. He looked fantastic. Went back to the GP. GP says, "Yeah, that's cool, but you got to go see the cardiologist." So he went to see the cardiologist and explained everything. And the cardiologist says, "This is absolutely impossible. It does not happen." And Robert, he was compliant and interested enough in proving the cardiologist wrong and he right, that he agreed to have another perfusion scan. And so he had another perfusion scan which showed clear reversal of this disease. And he went back to see the cardiologist, and the cardiologist said, They mixed up the studies. You know, in other words, they put the after and before. Yeah. Oh. Okay. However, the king of this business, the man who has changed more lives than anybody else in the last 30 years, is Dr. Dean Ornish. Yeah. No question about it. You ask, who's made all the difference? My professional friend, Dr. Dean Ornish. And this is just one of the many, many, many research papers he's published in respected medical journals showing that changing your diet in a direction that we're teaching you lowers cholesterol, triglycerides, gets rid of high blood pressure, obesity, insulin resistance, as I told you, our study has clearly shown, published on Friday. And 99% of people, based on perfusion scans, show that the disease has stopped or reversed. I'm so honored by this man and my friendship with him that in January 2015, I dedicated an entire newsletter to Dr. Dean Ornish. Small contribution to what he deserves. And that may serve as the whole introduction that I offer you in 12 and a half minutes to the man who's changed the entire planet in terms of the way they view heart disease and diet and so on. So rest yourself up. 12 minutes, you're going to get to meet the man who has my greatest respect and honor, should have yours, and deserves everything except the punishment that he's gotten. Thank you, ladies and gentlemen.